Okay, we are live right now with a juicy topic. Um, this one is something that I hear people talk about all the time, and essentially, it is: can spinal decompression fix your back pain or sciatica? And so, I hear people talking about this all the time about their sciatica. Can I just go do decompression? I heard that if I can decompress my spine, that it's going to relieve all the tension, it's going to relieve all the pain, it's going to solve the problem essentially, right? And that's what you hear people talking about all the time, is that this is going to be the thing that gets them over the hump. This is going to be the thing that solves their problem for the long term, right? And so that's what I want to talk about today: is that even a realistic thing for you to accomplish? Is that something that you should even want to do? Um, and realistically, that's something that you have to ask yourself: is this something that I think is going to be beneficial for me? Okay. So all that said, let's jump into this one. Just 1 second here. I'm actually just going to set up. Something's not working with my streaming software here, so just give me a second here. I'm just going to set something up real quick, and then we're going to jump right into it. I'm just having some issues on one of the sides here, so let's get that set up real quick. Okay, so technology is great when it's working, and not so much when it's not. And right now I'm having an issue. So let's try that again. Okay, I think we're good now. So we'll take a look. If we start all. Okay, so let's see if that works. I think it should work. Um, so we'll what the heck? You can see this. Okay, so we're still good here. Okay, so let's jump into this. I don't know why this isn't working, but oh, I think we're okay. Whew. Okay, we are live now. I was trying to get my Instagram thing set up, so if you're watching on freaking YouTube, you're like, what's wrong with this guy? Can we just get to the spinal decompression? I just want to know what to do. So, okay, so let's jump into it. Like I said, I got some really important information to share about spinal decompression, and really you want to know if this is something that you should even try, right? I've done spinal decompression myself. I know the ins and outs of it, so I want to share that with you to give you some insight on to if you think this is something that you should do at all. Okay, so let's jump into it. Um, when we're thinking about spinal decompression, um, we want to make sure that we actually know what it is. Okay. And so if you've been thinking about it before you try it, here's what you need to know. And the kicker here is it's not for everyone. So, what is spinal decompression? Essentially, spinal decompression therapy, it aims to relieve pressure on the spine by creating space between the vertebrae. Right? It's literally decompressing it, and it can be used for herniated or bulging discs, sciatic relief, chronic lower back pain relief. But the one thing that you do need to know, that it doesn't work for every type of disc injury. And in some cases, it can actually make pain worse. So at your own risk, essentially, with this here, okay? So there's different types of spinal decompression. So here they are: decompression machines. So these things apply controlled traction to stretch the spine. Now, these are the types of things you're going to see in chiropractic practices. It's the type that I've done, or I've done a few different types. And these are the ones that they'll get you set up, and they'll say, hey, it's going to be this much money. You got to commit to this many times, and we're going to get you on that machine. If you're, in my opinion, if you're going to try this, do not commit to a chiropractor that is going to lock you into sessions. Tell them that you want to do it once or twice, and that if it works, that you'll commit to long term. But don't do that up front, because it may not actually work, and you may actually just go once and you'll never get relief from it after that one time. So I've seen that in the past, where people try it and then uh, they only get the relief from that one time, and then like after that they've committed to paying for this like long-term thing. Um, and you don't want to do that, right? It's just going to be money lost on your part. So find out if it actually works for you first, okay? So that's decompression machines, and they are kind of optimized. They like oscillate in and out of it. They're like fancy tech. The next thing is inversion tables. Another thing that I used to have. So they use gravity to pull the spine apart. Essentially, you hang upside down, you hook your feet in it, and then you're supposed to meant to relax, and you can like change the level of inversion. So I had one of these. I used to use them. It did provide some some basic relief for me, but at the end of the day, like it wasn't like lasting, right? So it was good in the moment, and at the end of the day, it's like one of those things where you use it, but it's not going to solve your problem. And again, in some people, it makes it worse. And then you have manual decompression. So this is kind of like maybe from a chiropractor or a therapist. They use hands-on traction, but you can also do it yourself. So you can actually do manual decompression by literally pushing up. If you had like two chairs, for example, you could like push down between two chairs, and you could actually use that to decompress your spine. Okay, so I do have I actually have a how-to on that. So again, keep in mind here, I'm not actually anti-decompression. Okay, so that's the one thing I want you to understand. Definitely not anti-decompression, because like I use it as a part of a holistic kind of approach to solving this, but it's not going to actually just solve your pain outright. Okay, if that makes sense. So just keep that in mind when you're thinking about any of these things. Okay. Okay, so what are the problems with decompression? It's not always safe, and that's the big thing here. Is decompression, it's not like a one size fits all solution here. It can help some disc injuries, but it can make others worse. And so the wrong type of decompression for your condition can cause increased pain, nerve irritation, or even disc damage. Okay. So why can it help you? Why can decompression help? Um, it may provide relief for things like bulging discs. Okay, obviously, uh, where the nucleus is still inside the annulus. So real quick here, if you've had a bulging disc, so the disc is like self-contained, and a bulging disc would be like it's kind of like pushing out, but it hasn't ruptured. Okay, and so if that's the case, and it's just pushing on the nerve, but it hasn't ruptured out of the casing, out of the annulus, then like technically by providing some decompression, you could actually have that go back in. So that's the idea behind it. Okay. Um, if you have a mid to moderate disc herniation, that causes nerve compression, and then obviously sciatic caused by disc pressure on the nerve roots. So um, only when used correctly and under professional guidance, that's the thing that you have to really pay attention to. Is you do not want to do this on your own. And again, if you have a inversion table, like you're likely doing it on your own, right? I did it on my own. But the thing is you got to be really cautious. If it makes the pain worse, you got to avoid it. Okay. So if you like have like a severely ruptured or extruded or like really bad disc, and you've like got the MRI and pulling the spine apart can actually worsen the nerve irritation, right? And you do not want that. The other thing is if you have some spinal instability, decompression can make the spine less stable. If you have really bad osteoporosis or fractures, it can increase movement, or that pulling apart can cause further injury as well. Okay. And then any acute inflammation or swelling in the lower back could increase nerve sensitivity. So those are all things that could happen if you were doing spinal decompression. So this is one of those things where really you're just going to have to go and try it for yourself. At the end of this, I'll tell you kind of about what I do when it comes to decompression and why I think it's better than doing it at a chiropractor, and why I think it's better than using an inversion table. Okay, so stay tuned to that. I'll kind of explain at the end. Okay, so why decompression alone will not fix the root cause. If you don't strengthen or move correctly, even if you use decompression, the pain will just come back, right? Or when it just gets compressed again, it's going to hurt, right? Decompression doesn't fix weak muscles or poor movement habits, right? Your body needs stability, not just space between the vertebrae. So again, to reiterate, it can be part of a larger process of healing, but it isn't going to fix it outright, right? So if you're just trying to rely on that, oh, this is going to fix it, this is going to fix it, and you're not doing anything else, well, it's not going to last. So even if you get short-term relief, guess what? It's still going to be there later. It's going to come back. And in some cases, it might come back even worse, right? So what is the right approach for lasting relief? Well, first and foremost, what you need to do, okay, is you need to identify what type of disc issue you have, right? That's the big thing. If it's decompression, if decompression is appropriate, use it alongside strength and stability training. So if you find decompression therapy gives you relief, then you have to pair that with strength and stability training. And then correct movement patterns are super important to prevent future disc problems. And so really what's the right approach is starting some form of regress strength training, all right, is big time. And then after that, combining that with some decompression maybe, right? Maybe that's something that's going to help you, okay? But again, you need the thing that's going to actually make it stick, okay? So again, fixing it first is probably the best thing you do here, because even if decompression helps, you're still going to have to rebuild the body at the end of the day. And decompression therapy provides relief, but movement creates lasting change, right? And at the end of the day, you have to be honest with yourself. You want lasting change, right? That's what you want here. You want this to be something that sticks with you for the rest of your life. And most people see major improvements by strengthening and correcting movement, right? People who don't even do decompression get improvement, right? So decompression, like I said, can be a tool, but it should not be something you rely on, okay? So what's the smarter long-term solution? As we discussed, decompression equals temporary relief, but not a long-term fix. You can combine strength and mobility in the hips, for example, and stability training. You're going to have lasting pain relief and most importantly, injury prevention. Right? You need to move better to feel better, essentially, right? So like rather than focusing on pain and pain relief, what you need to do is focusing on actually moving better and building strength without causing more pain, if that makes sense, right? So you want to find a system that will allow you to build your body up in a way that doesn't cause a ton of pain, okay? Where you can like work below your pain tolerance and build, okay? So if you want a real solution for your herniated disc or sciatica and you're tired of temporary quick fixes and you really want to rebuild your body, and this is just something that you've been like, look, I've had enough of this. If you want to learn how to heal your body, I've put together a free program. It is literally some of my best work, and I'll give that to you. So all you got to do is comment back pain. If you're in a place where you can DM me. But realistically, it's going to be a free training for you. Okay, so as I said, what I'm going to give you now also is what I like to do. And I like to do a self-decompression. So I don't struggle with back pain anymore, but I still decompress my spine once in a while because I'm a kind of a maniac with spine health. So I really want to take care of my spine at all times. Okay, and so what I like to do is a decompression technique that is on my YouTube channel, and I'll share that with you if you just comment below. Okay, just comment back pain, and I'll share with you my decompression technique that you can do anywhere, anytime, and that way you can avoid spending a bunch of money, and you can potentially get some of the same relief that you would if you were spending a bunch of money on an inversion table or going to see a chiropractor and using their machines. Okay. All right, that's all I got for today. I am out of here. All right, peace.